Greetings and welcome to the International Pediatric Simulation Society podcast. This show is for people passionate about pediatric simulation-based education, training, and research. Podcast hosts are members of IPSS, a global community of multidisciplinary healthcare professionals from over 30 countries, all dedicated to improving the care of infants and children worldwide. Each week, one of our sub-hosts, Christine Bailey, Elaine Ng, Erin Carn-Bennett, and myself, Samreen Vora, will introduce you to a new guest and bring you into a conversation with simulationists and healthcare professionals from across the world. Come along.
I'm Erin Carn-Bennett. I waited until after I recorded this episode to record this bio. I decided to mix it up a little bit. I'm so glad that I waited to read out this bio of Professor Cristina Diaz-Navarro. She is a fantastic woman, and I was blown away with the experience of interviewing her. She has achieved so much in her career, which I'll read out for you shortly. It was a delightful interview, and I got so much from it, and I hope that you enjoy listening as well. Christine is a consultant anaesthetist and the academic head for perioperative care at Cardiff and Vale University Health Board. She is the chair of the Simulation Advisory Group at the Royal College of Anaesthetists. Christine is also an honorary professor in medical education at the School of Medicine, Cardiff University, and an associate professor for the School of Medicine and Healthcare Sciences at the University of Barcelona. She's currently the president-elect for the European Simulation Society, or SESAM, and during her role as the chair of SESAM Scientific Committee, she led the publication of the Global Consensus Statement on Healthcare Simulation. Christine is also the lead author in the creation of the Talk Approach to Clinical Debriefing, which has been translated into 9 languages and used in 30 countries. She chairs the Board of Trustees of the Talk Foundation. As an Associate Dean for the Simulation at Health Education and Improvement Wales, her focus was on faculty development and quality assurance in simulation. As an Executive Committee member at the Association for Simulation in Healthcare Practice, or ASPE, she led the development of the ASPE standards in 2023. Christina's been involved in simulation-based education and debriefing since 2006. She enjoys developing innovative simulation-based projects that encourage new perspectives for reflection on everyday elements of healthcare. I'm sure that you're going to enjoy listening to this interview that I had with Cristina. I hope that you get out of it as much as I did. I will link all the things in the show notes. Thanks for being on IPSS the Podcast today. Welcome to IPSS the Podcast. I'm really pleased to have Dr. Cristina Diaz-Navarro with us today. I'm really excited to interview you today, Cristina. As we've already heard, your bio is quite something. I wanted to dive right in. One of my favorite parts of this podcast, and of any sim podcast really, is talking about people's journeys into simulation, especially the big noters in simulation. So I would love to hear your story about, 1, your first simulation and the impact that had on you, and 2, how did you then become a simulationist?
So those are very different questions. I'm not sure whether you're going to like this or not, but I'm going to tell you anyway. My first simulation actually was not a medical simulation, it was a language simulation. I remember being a very young child, learning French in school. And when I played with my dolls would only speak French. And, it was that sort of game that I played. And it was super interesting in terms of learning to use only the words that I knew. So later on, in more proper style, when I started learning medicine, my first simulation was like many people of my age with an orange and learning to give an intramuscular injection to an orange. And my first where more traditional simulation came my way was during resuscitation training, which again, not an unusual story as a learner. I started working with simulation first in resuscitation environments, running moulages and skill stations. But in 2008, in my department, they were setting up a simulation program. And simulation wasn't all that well established at the time. So it was very apparent to me when I started helping out. I was a lecturer in medical education, and there was a quality assurance component that was missing in those early stages. So that's where I started finding it really, really fascinating.
I was a new graduate nurse in 2008. And that's when simulation first started up in our department as well. So I was lucky enough. My health career grew up through simulation. We had Peter Weinstock and the Boston Children's team and their advocacy inquiry methodology sort of come through at that time. It was like really profound and had a really big impact on my practice from day one. So
that's so interesting. For us, it was USIM. They were starting to provide courses at a European level. My group started growing following a USIM approach. But it was so helpful to be able to structure our experience and our intention in a way that could be replicated a little bit more consistently. It made a big difference to us. For me, I was already an anaesthetist in training. I was a resident at the time. I had been a doctor for a number of years already. And it was really interesting. I mean, I came to the UK when I was 28 years old, and I wasn't fully bilingual. I could speak French or English or Basque or Spanish. Spanish was good. The rest were sort of so-so. So I had to find myself in English as a person and as a healthcare professional as I became studying anesthesia. And then when I was established and quite comfortable with myself, all of a sudden I fell into education. And that was a really interesting time, again, of not just learning and supporting others, but self-discovery. So that was really fascinating. And simulation helped no end, to work out behaviors and so on. Yeah.
I've found it the same as like a really fantastic tool for self-discovery, breaking down perfectionism and reflecting on your mistakes and encouraging others to make mistakes in simulation and learning so much about humans. Like it's such a wonderful field to do that in, right? Yeah.
It really is. It really, really is. Simulation was a really good way of learning to listen better. That really was important for me. Yeah, and also learning to articulate certain things that often go unsaid. That was really, really important for me too.
Yeah, it's such a, I find it such a special space. One of our leads of our local New Zealand Simulation Society, NZ-, Brad Peckler, he mentioned at our last conference about simulation being a bright space in healthcare. And it's so true, isn't it, to hold these spaces for people to be able to share and to unpack and to be able to witness people have these aha moments in real time that you think, I know from my own experience, you're probably going to be thinking about this in 10 or 20 years' time. It's really, really cool, isn't it? It's such a cool job. And I'm not sure if you find the same, but I've done a lot of work at our university here with the undergraduate students, and that's a really special space too to, get in before they even get into their working life. It's really amazed me how it's profound to them to say, I don't know. I don't know the answer to that. Does anyone else know? And they're like, you can say that? Absolutely. We want you to say that. That's the best thing that you can say. It's a really cool thing to be able to be a part of. But I'm really, really interested to hear about sort of some of your affiliations. And, in IPSS, obviously, we're a very small society, but we've got a lot of impact as well. And we've got a lot of things that we want to do. Do you want to just talk a little bit about the impact that societies have had for you in your career?
ASPI is a UK-based society but has got international membership, and it is the Simulation Society for the UK. And I have been a member for a very long time, and I've been nearly as long a member of SESAM. So I belong to both societies, and I've served both societies as well in different roles. Became closer to the leadership in ASPI when I was working as an Associate Dean for Simulation for Wales. I felt it was very important to have that closer link with the National Society and represent Wales, because, as you know, the UK has got 4 nations. It was important for me that Wales, which is where I live, was well represented with regards to wider national and international initiatives. So when I was accepted into the executive committee, my interest at the time was to help with standards. And that was because, as I mentioned in the beginning, quality assurance was already interesting to me from the start of my simulation career. And when the first ASPI standards were developed in 2016, I was part of that consultation. And when they came out, they were actually super helpful, setting up better ways of developing content for our faculty development courses, etc. I felt it was time to give back and to support the next generation with the renewed standards, because of course during that time between 2016 and 2023 simulation has evolved so very much. The standards needed to adapt to the new context. So that was a labor of love with a lovely team of the ASPE exec, and many weekends into finding the best way forward. But it was a good experience from the point of view that the new development of the standards, so the updating of the standards, was very consultative. So it wasn't a group of us making decisions for the community. We actually reached out to find out what would help people, what in the standards was helpful as it was, what needed to change, and what maybe wasn't there that needed to be added. And it was that consultation that then grew what are now the ASPE Standards 2023. So that was a really lovely process of growth and learning and contributing to something that now is helping others. So that was really lovely. And at the time that I was in the executive committee of ASPE, I was invited to be the chair of the scientific committee for SESAM. And I really like SESAM, and I really like the conferences, and to be able to be part of that for me was just such a privilege. I ensured that both societies were happy with me having both these roles, which they were, and then I embarked in a different way of learning, which was sort of setting up the SESAM conferences, and it was immediately post-COVID, so there was a big appetite for attending face-to-face events, and I have to say, working with SESAM and curating content for the conference has been a real privilege. I've done it for 3 years. During that time, attendance has doubled to the conferences. Wow. And perhaps the way that we set up keynotes also changed a little bit. So we've broadened the way that keynotes are provided at SESAM with more collaborative sessions, and certainly making a very concerted effort to represent diversity. That was just a lovely journey. The way that we select abstracts is very rigorous. It was already before. My predecessor, Carla Sakoto, was incredible at setting a really lovely level of quality in the abstract selection. So we just grew from that. And now my successor is Michaela Kolbe, who is one of my heroes. And it's just such a pleasure to be able to support her in this role and see how the role evolves now that I'm doing something else. So that's been super interesting. Of course, when I started working as chair of the scientific committee, I became much more closer to the executive committee at the time. We're now executive board. And I felt that perhaps it was reasonable to offer my service for the position of president-elect, which I'm very happy to have got. And I'm now doing a different type of learning because, of course, I knew a lot about finding content for the conference, but I didn't realize quite how much logistics and for how long one needs to prepare for a large event like this. And also, we're not only looking after the event. As a board, we're looking after the whole membership and the whole set of needs of our communities of practice. And there's so much to running a society that is not seen. It's a new challenge, and I'm loving it because I work with really good people. And that makes it worth it. And also, I like doing it because it's a really good way of making a good impact on what's happening in our community. I think if anyone is thinking of getting into society leadership for self-promotion, that's just not the right way. If it is, you really have to have a good reason and a little bit of a vocation to fall into roles like this and do them and enjoy them. You have to know that what you do has to be to improve the society. It would be very frustrating, I'm sure.
Most definitely. That service piece is so important, isn't it? And the SESAM, everything that comes out just looks fantastic. I really hope to make it to SESAM sometime. But as a nurse, we only get so much funding, and I've been incredibly fortunate to get funding from the Starship Foundation to go to IPSSW while I've been on the board of directors. But it's definitely on my 5-year plan for sure. It looks fantastic.
But that's what you're saying is very important, because it's not lots of healthcare professionals are in that sort of situation that they're not released to attend events. And to be honest, certainly in the UK, even education professionals are also not being released, limited in terms of what leave they take and whatnot. And I think that as societies, we need to consider the needs of the membership who cannot attend events. What can we do for people who will not be able to come to the conference? Because whether it is about making searching content accessible differently, whether it is providing other opportunities to feel part of the community. But
Yes.
that's the thing. I mean, you're in New Zealand, I'm in the UK, different time zones, and we're having a conversation and it's easy. So we can benefit from the way that we are evolving as a society and the way we use our resources. And I think we really have to learn to make the best of these opportunities to facilitate learning outside conference time as well.
Yes, I totally agree. Part of us starting IPSS the podcast is to have that reach for members as well. We're getting up into almost 40 plus countries now of listeners,
Wow.
which is fantastic. And it's lovely to be able to see that some of these countries, I don't even know where this is. So that's fantastic that someone's listening from there. And it's important to get those resources out into those places that really do need it, you know. We are fortunate, I'm sure you probably find the same, being in person with other simulationists is so lovely. There's so many amazing collaborations and projects that come out of a happy hour drink, and simulation people are so fun. It's a great thing to be a part of, and it's always just a real privilege to be able to go and do it in person for sure. And do you have any goals for your time in your presidency? Anything that you're really hoping to achieve?
So the way that the presidency works, the first year I'm president-elect, then I will have 2 years as president, and then I will be 1 year as immediate past president. So when I took on the role, in my mind, I thought, I know what I want to do. And right now, I'm learning so very much about the work that is to do, that is probably not the one goal. I would say that there is quite a lot that we should do. I think that the priority is always not about what we want, it's about what the community needs. Yes. I think that aligning what we do with the needs of our members is paramount, and perhaps engaging with our members differently might help align better. If I can choose one thing, I want to make it easy to get simulation right. What way? That's the difficult thing, and particularly what way without alienating so many, because simulation is growing in breadth, and its uses and its modalities and the way that we look at it, it's all changing. And I think that it's really important to keep an open view of what our community means. So yeah. That's the way
really like that answer. I think it's like when you come into a new leadership position as well, isn't it? It's sort of like you almost just need to figure things out as well, don't you? And just taking that time to get to know people and to settle in. It's almost like moving into a new house and you don't want to remodel the kitchen immediately. You want to figure things out of where you can have your biggest impact.
But keep in mind that SESAM has got a very democratic executive board, so and we've grown, so there were less positions. There are some more. We're still not too many. We've got an executive director who's absolutely amazing, and she's helping us get the job done. She's incredible. She's called Kirsten, and she really is something very special. But also there are elected members. All the members are elected. So we've got 7 or 8 of us, and we make collaborative decisions. So even when I'm president, I don't think it's going to be what I want that will happen. It will be what the board will decide that will happen. So, and I quite like that. Yeah. So perhaps my role as president would be to consider where to prioritize certain actions. But again, it will not be my decision. I'll prioritize in conversation, and then we will all together decide where we go. That's quite good. I think the way forward to role model, as well as anything else, collaborative decision making. And the reason I'm saying this is because I work clinically as an anaesthetist, so I'm mostly a clinician. Most of my work is really providing anesthesia for certain specialties, and I work with a number of professionals that come from different backgrounds. I work with surgeons, I work with nurses, I work with AHPs, I work with so much diversity of professionals, and we all bring different perspectives, and we all care about the patients similarly, and we need to learn to listen to each other better and work better together and make decisions together better. And I think that that's something that can be represented and modeled from societies as well. So I feel that SESAM is already doing that. It's a very multi-professional society. Sometimes it surprises me when someone asks me, what professional background does this person have? And it's not something that comes to my mind, what professional background they have. It's what work are they doing for simulation? How are they contributing to this project? I think that is something that happens at many, many layers within the society. And I quite like that.
Not being so wrapped up in your clinical identity, just... more in your humanness. I think that's really important. I totally agree. Helps to break down those hierarchies as well too, doesn't it? And to encourage more sharing and connection with each other. It's fantastic. Of course, we need to talk about, and I'm really, really interested to know about, is your Talk Foundation. I went through a process over the last 5 years of creating my own simulation course modality and debrief modality alongside one of our team members, Kang Higan, and our extended team. And so I'm really interested to talk to you about the Talk Foundation and your talk debriefing methodology.
For me, talk is a big part of my academic work. Sometimes when you are very wrapped up into something, it's difficult to bring it down to something quick. I would say probably that the easiest thing to explain this is that in simulation, debriefing is complex, and to be an efficient and compassionate and effective and helpful facilitator takes lots of years of preparation. And when I've been leading faculty development initiatives for simulation practitioners, debriefing is something that takes a long, long time to get right. So in 2014, I was with two of my faculty colleagues, and we were thinking, if we want individuals to debrief in healthcare, we need to think differently. We cannot be thinking as debriefing experts, because debriefing experts will only be available in certain places and at certain times. We need to be able to make debriefing conversation safe and easy, and easy to teach and easy to apply.
Love that.
So it kind of put the whole concept on its head, and it took us a while to bring a structure that we felt would be useful down to some key sentences that would be easy to apply, and we developed cognitive aids that would be very easy to carry around and to use with safety. One of the things that we had to do for that, and one of the things that was hardest for me, was to not include emotions in this debriefing.
Yeah, that was one of my questions. I noticed that. I was fascinated.
Because anyone to be able to debrief, you have to be able to train them in what they need to do relatively quickly. And if you want to debrief on emotions, you have to have a lot of training to debrief emotions meaningfully. You know, the last thing I wanted was for people to start saying, so how are you feeling? And then ignore it and move on.
Yeah.
You know what I mean? So it was very important for us that the conversation that we've facilitated between healthcare professionals to do independently at any time, anywhere, would be easy and would be safe. And part of that safety was to actually allow them to have a conversation that was centered on the patient. Because in healthcare, we talk about our patients all the time. And if sometimes, you can see people having different agendas in healthcare, all of them are trying to achieve what's best for the patient, but they're trying that from different perspectives. So we felt that was a really good grounding point. So if we talk about what is best for the patient, then we can share our perspectives in a way that is not personal.
Yeah.
You see?
Like that.
So that's the way we started thinking about it. So we started thinking about it, but of course we were educators, and we started bringing together multi-professional teams and people who were not in simulation, so that they would give us that perspective, oh, this makes sense, or it doesn't make sense, or I would be happy using it or not. Then we got a grant from the EU, a Marie Curie grant, and that was really, really helpful because it allowed us the time to develop and fine-tune what a tool could be like. And we did that internationally with teams from UK, from Spain, and from Norway. And we came together with a structure that was actually broadly applicable across different cultures, and that it had potential for people to learn it relatively quickly. Our training course for users of the tool is between an hour and a half and 2 hours.
Fantastic.
And we've got the standardized courses. So we felt that was one decision, was getting rid of the emotions. That was quite hard. Then the second decision was, what do we do now with this tool? Because if we put it out there and we don't collect data, we will not have data. But at the same time, if we want clinicians to do this for themselves, we probably shouldn't be micromanaging them. Or, the point of this is not to do wonderful research. The point of this is to have good conversations. So we made that decision as well, not to collect data with each conversation, but giving the tools for people to have their own conversations, whether we knew about them or not. And with that, we felt it was going to provide an element of viral growth to the initiative, which was in itself quite disruptive, because that's not the way that we handle debriefing in simulation. So it's kind of departing with a number of things that are very dear to me. One of them is control, but
I can so relate.
But it was about allowing clinicians to take ownership of their own conversations and giving them the basic tools to get productive conversations right. So we did that, and we saw that there was so much interest. So then the next step was, we are doing this without any interest in commercializing this. We want it to be free. So we ended up, we designed the tool in 2014. In 2015, we started sharing it for peer review. In 2016, we got the grant. In 2018, we set up a charity, so that when the project finished, the tool would be protected from commercial interest. So that's how the Talk Foundation was set up. So what we do is we've set up a cascade learning system. So we have instructor courses. All our educators are volunteers. The instructor courses are at minimum cost, and we look at where people come from. So if you come from a low income country, it will be even less. So we really try and make it accessible. And then when people do the instructor course, they receive standardized materials, and they can give out the user course as many times as they want without having to pay any fees or anything. We provide free certificates. So that means that, for instance, to give you an idea, over the last 3 years in Latin America, we have trained in debriefing over 3,000 people.
Fantastic.
Yeah.
So impactful, Cristina. That's fantastic.
So it's really lovely. I was looking at the statistics a couple of weeks ago, and we've got Talk is being used in 32 countries that have been reported to us directly. But I looked at the website for the last year, and it's been accessed from 88 countries. So, it seems to be filling this gap that has not been covered by anything else, for people who want to have conversations and don't know how to do it. We're trying to facilitate that, really. And I'm hoping that they're using the tool well.
Yeah. And is that mostly for after critical events, or is it being used within simulation as well?
No, it's not for critical events. It's for everyday debriefing. So the approach is very
just any case, kind of.
Anything, yes. Ideally not too critical, in fact, because if you want to have a critical event debriefed, you do need expertise. You cannot have someone rocking up with a little cognitive aid saying, I'm going to debrief this, mate. No, you really have to have someone with skills to do complex event debriefing. And And there are different approaches that are being used for it. And if you look at the literature, I'm not sure we've articulated yet well enough what this debriefing for complex events in healthcare should be like. There are lots of people doing it right, but I am not sure we're articulating it right in a way as to enable consistent reproduction. I think that there is a lot to do in this field.
Oh, yeah. And it's quite tiered as well, isn't it? Because what's an everyday event in one area might not be in another, isn't it? And I think, it's very interesting, isn't it, of what triggers it to be at what level, hot debrief, cold debrief. Like our team here, Dr. Jo Hegarty, who's the director of our program, she developed something called the After Critical Event Review, or the ACE review that we use here, which is similar. And, sort of teams come with, or teams use it with essentially no training. And then we've got other areas in the hospital on the adult side that have a tool, but they have training attached to it. Like this, and I've been trained in workplace trauma debriefing for corporate, which I did a little bit of, which was fascinating as well. All this kind of like psychological first aid stuff is really, really important, eh?
Well, I've got my doubts about this. I think that psychological first aid might be helpful. The latest meta-analysis that I have seen on work-related trauma does not provide conclusive evidence that debriefing helps.
Yeah.
So the question is, if we're wanting to deal with trauma, who should do it?
So true.
My opinion is that as an anaesthetist, it probably shouldn't be me. I would be much happier to have a psychologist dealing with that.
Oh, gosh, yeah.
Right. So that brings us back to Michaela Kolbe's paper on aligning debriefing intention and impact in healthcare environments. So if we debrief to learn and improve, that's fairly safe. If we debrief to treat trauma, that's not quite so safe, and we really should have specialist teams doing that. And then when we have complex events, then there is a mixture, as you have very well expressed, Erin, in which we have the psychological impact, but also we've got the other components of the event that need to be analyzed by someone who's able to facilitate a conversation, which includes performance elements, which includes social cognitive skills elements, which includes system analysis. So there is something that is quite difficult to get right. And yet people are doing it, and they are doing it very, very well. And I wonder somehow, I see some of my colleagues who are very, very good debriefers, and they're doing it intuitively, right? So they've had some debriefing training, but not really training for what they are doing, and they are doing it fantastically well. So my question is, how do we bottle that?
Yes, I agree. It's so fascinating, isn't it? And I've met people, and what training have you had? Like, you're 10 years ahead of where I was at this point, and nothing. And you're like, what? Like, it is in that intuitive sense, isn't it? And it's also in the participants you see as well. For some people, the feelings are so important, and they really need that part before they can reflect on their actions and results almost. And for others, it doesn't matter how many times you ask them how they're feeling. They don't want to talk about the feelings. They only want to talk about their actions and results. And I think people reflect and they make sense of things in different ways, don't they? And when you're debriefing, you have to be so adaptive. And at the end of every debrief, I usually think back and think, oh gosh, there's always something that I've learned that I thought I could have done better or changed, or did I get that quite right for the participants? It is such a hard skill, and I don't know the answer either. I mean, I'd love to think that we could have psychology on call for us all the time, but it's, again, is that even the right thing? I'm not too sure, but...
No, me neither.
Yeah.
And so that is a level of complexity that requires, I'm sure that there will be much research to be done in this area and many initiatives. that's not what I wanted to do with Doc. With Doc, what I wanted was to offer people the opportunity to have small debriefing conversations every day. You finish your day in the intensive care unit and you have a conversation, or you finish your day in the operating theatre and you have a conversation about anything, not necessarily about things that have gone wrong, and in fact, if possible, about things that have gone well as well, so that we can replicate them. Or you have a patient encounter and you need to have a conversation, and you have a conversation that is structured and aimed at getting an outcome that will be beneficial for the patient and for the workers. We all have to adapt in our own environment, and this adaptation is so important. And if we don't have these conversations that are shared reflections that allow us to come to agreement on what we're going to do next, it's sort of difficult to make things concrete in a way that will advance the way we work together. So what we wanted was to facilitate these everyday conversations, and that's what Talk is aiming to do, really.
And I think that's so important. So the course that I co-designed is called Sim to Lead. In our introductions phase, it's called the campfire, and just literally we have a small simulated campfire. We turn the lights off and we all just sit and connect with one another and share stories.
That's lovely.
And it is really, really lovely. And it's so fascinating, like just some of the depth of things that people will share. And there's such a lack of spaces for us all to sit and do that in healthcare as well. And one of the other things, we've talked a little bit about listening as well. And one of the other fascinating things I've learned, and I'm sure you've learned so much as well in the whole designing your own debrief, we have coaches teaching leadership skills as facilitators for, leading a resuscitation event for nursing and medical. And it was really fascinating because we couldn't figure out why this debrief methodology wasn't quite gelling. And because it's centered around the leadership and trying to keep it safe, but talking about the leaders and the leadership and the teaming. One of the most major tweaks that we made to the debrief methodology from one of my nursing colleagues was, you need to ask them about what they've heard you say, not what you've told them. And so we said to the leaders, we were whispering things in your ear to get you to reflect in the moment. Tell us about your experience. Like, what did you hear? And 99% of the time, it's not what I've actually said. It's really interesting to go, oh my gosh, that's what they took from when I said that. That was a way aha moment of fascination. Yeah.
I think that's so often the way that miscommunication happens. You think one thing, you say something that is not exactly the same, and then the next person hears something very different from what you have said and interprets it differently again. So this is something that with verbal communication happens, even if things like the tone can help maybe work out what the other person is trying to say, but it happens all the time with emails and text messages.
Oh yes, right? The struggle of trying to dissect a text message. I'm a real nerd in the body language space. I don't know if you've dived into that rabbit hole at all, but reading people through their body language, and that's another whole really, really interesting space. And
we end up interpreting things through our own lens, and what's interesting is to find out what the person that you have in front of you is considering when they're interpreting life, and that takes time.
Lifelong skill, isn't it? So I guess, we've definitely been down our own little rabbit hole there, but I'm so glad we went there. I'm definitely going to link up in the show notes, the Talk Foundation. And I think it's just such fantastic work that you're doing there. And obviously link up all of your other affiliations and things, and SESAM and ASPE. But as I was mentioned earlier, we're quite a small society, IPSS. So how can we partner alongside you with SESAM? Like, I know a lot of our members do come along to SESAM as well, but is there anything that we can do as a small society to partner alongside you?
Well, there are different layers to that answer, and there is a very short answer, which is we definitely can do lots of things. What I think is very, very easy is to start collaborating during conferences. This is something that SESAM has done for a while already. So every year we do invite societies to do collaborative workshops. And that is really lovely because the society has got the opportunity to showcase what they are doing, and we get to know each other better, and then we identify what ways we could collaborate further, whether it is through specific projects or whether it is through communities of practice. So I think SESAM is very collaborative as a society. That's one of the things that I like about it. And, you know, certainly I've known of IPSS for a long, long time. I think that the first time I went to one of your conferences was in Boston in 2017, it might have been.
Nice.
So I think that the work that you do is absolutely amazing. And I think that we've got so many common goals, it would not be difficult to find ways forward together.
Yeah, absolutely. And in Te Ao Māori culture in New Zealand, we call that whakawhanangatanga, which is your connection and building connection together. And I think it's spaces like this that show that our Indigenous cultures are so onto it with this stuff, right? Because now I know Cristina, I know all about your work and I know what you're doing. And it's just that flow on effect, isn't it? Of I'll go out and I'll be talking to the people from theatre or the surgeons or other teams, and I'll be like, have you seen the work of this? And then it just starts to flow, doesn't it? And if I know you're going to a conference, we'll catch up, and it just helps to really build that connection. And the whakawhanangatanga is strong and it's important. It's a really cool thing to do, to just meet other people and hear about what they're up to, and then to know them and to share their work. It's important. What's some other exciting sim or other news that you have to share, Cristina? What's going on for you at the moment?
Oh, gosh. I think, I mean, if you ask me about exciting news, I have to say, completely biased, I think Leon is going to be quite special this summer. I cannot divulge what we're preparing just yet, but I think that this SESAM conference is going to be quite special for different reasons.
Actually, tell us a bit more about the location. Like, I've heard a few bits and pieces. I know a few people who are looking to go. So tell us a bit more while you're here.
So I've been to Lyon before, to other conferences, not to a SESAM conference. It's a fantastic city in France. The food is absolutely amazing, but there is an atmosphere which is just conducive to conversations and laughter. So I can't wait. My husband is coming along as well. He's not in simulation, but he just wants to come for the ride, and I can see why. And what excites me is not just about the place itself. I mean, the Congress Center that the board chose before I came along is magnificent. So I think that the space will be brilliant in terms of facilitating opportunities for connection, and it's a large space, and we will need it as well. But I think that there is something about the program, and perhaps I would say the theme is to celebrate the diverse community of simulation in healthcare, and that is indeed coming together. There is a lot about how different we are and how much we have in common, and how we can celebrate, bringing all of these different elements of our community together and advocate for it. I just think it's going to be a lovely event.
That's fantastic. And you have a journal that's attached to SESAM as well, isn't it?
Yes, Advances in Simulation. It's a fantastic journal. It's grown so much. It's got the highest impact factor of the simulation journals currently. And that's, without a doubt, in great part, thank you to Gabe Reevy, who's the editor-in-chief. He's fantastic. And they've got a really amazing team of editors and contributors. Yes, he's doing really, really well.
We had a fellow for 2 years, Dr. Laura Newhouse, and actually our admin lady who had a background in editing and her master's in psychology and things, and they wrote a paper that was published in Advances in Simulation earlier this year about the reluctant simulation participant. And
they
yes,
did very
we
well.
were thrilled.
They did very well because their acceptance rate is not very high. So the paper must have been very good. Yeah.
Yeah, it was a fantastic paper. And yeah, we can also link that one in the show notes as well. And shout out to Laura and Nairi, who did just such a fantastic qualitative analysis of interviewing people who don't like simulation and why. And it was really, really interesting.
That sounds lovely. I haven't read it yet, but I certainly will.
I wanted to ask you, Cristina, you're such a busy lady and you've got so much wisdom. How do you maintain balance, and do you? Is it even possible? Do you have any tips for people out there with many roles?
That sounds lovely. I am still mostly a clinician. I'm a mother that has brought a lot of balance to my life, although my children are now grown up, both of them in uni. I'm a wife, and I think that I probably abandoned my husband a bit more than I should, but he still likes me, so that's a good thing. And I think that what probably makes the simulation journey worthwhile for me is that I do it with passion. I really enjoy it. And I have to say, I'm in a very privileged position, and this allows me to take on what I like and not take on what I really don't fancy doing. I think that that's my secret. I put my effort into what I feel will be useful for others and which I enjoy during the way. That's my secret.
I like that. If it's not an absolute yes, it's a no. It's very true, especially as women, we can be guilty of just, taking on far too much and doing too much. And, instead of saying no, the whānau first or the family first is important too, isn't it? For sure. I've just recently returned to doing clinical work again after a break alongside my simulation work. And I'm loving just being back with patients, and just it fills you up to then want to give more at home and give more in your simulation roles as well, doesn't it?
And it grounds you. I think that working with patients, I mean, particularly in anesthesia, which is a high stakes specialty, we know what's important and how badly wrong things can go. And I think that allows for a little bit of perspective with other frustrations of life as well.
Absolutely. Yeah. I often come home from a shift and think, you know what, my problems aren't problems. But being able to be there for people in those moments is very profound, isn't it? Yeah. Thank you for such a lovely conversation, Dina. It's been
my pleasure,
good to have you.
Yes, I didn't expect it to be like this. I wasn't quite sure how this was going to go, but it's been so enjoyable to just chat with you and getting to know you through this conversation as well, Erin. And I really, really thank you for the opportunity.
Oh, thank you.
Thank you for listening to this episode of the IPSS Podcast. A special thanks to our behind-the-scenes producer, the talented Danish Kumar, and to the Starship Foundation for providing the equipment that makes this podcast possible. Join us next time.